Hi, I'm Kathy Tombaugh, and I'm very excited to welcome Christopher Doyle today, who is an interventionist and the head substance abuse counselor for the New York City Fire Department. So welcome, Christopher. Thank you for coming by.
Thank you so much. It's good to see you again. Happy to be here.
Yeah, same to you. So Christopher, can you tell us about your family story and what led you to do what you're doing? The work that you're doing right now.
Yeah, so I grew up with two parents who, fortunately for me, were in recovery from alcoholism and addiction already. So they had some experience in that regard, but they were sober. And so I didn't really have any experience, although my father relapsed when when my mother was pregnant with me. And so he wound up getting sober when I was about 5 years old. So my working memory with my father, even though they were divorced, I had a very good relationship with both parents. They were sober, and so they were positive influences and modeled recovery in that way. I, of course, later on became an alcoholic addict myself. I got sober pretty young. And then after working with peers and helping people in getting sober and, doing that sort of thing, I became a firefighter. And then the fire department had counseling services that they provided for the membership for firefighters and first responders. And then, an opportunity became available. I went down there to help. I completed schooling to become a counselor, as well as, and then eventually became, trained in intervention because I saw the need.
Okay. Well, that's great. Well, first, congrats on your recovery. I mean, that's wonderful. I know it's been a while, but yeah, that's always, and I also just appreciate too that you're out speaking to people and you're open about it, because I think that helps a lot. And I totally get why people do want to keep kind of more quiet about it, but I certainly really appreciate people who, want to talk about it and share their experiences. So yeah, I'm curious about your role at the city fire department. So what has been your experience with the head substance abuse counselor? And you mentioned, I believe in your bio, that as you can imagine, drinking isn't just acceptable for firefighters, it's encouraged. So if you can talk a little bit about that. I mean, they're in a role, and I think other professions probably find themselves in a similar role. So yeah.
Sure. And I think that alcohol use is probably central to a lot of professions, as I have found out over the years, which is always a surprise in a way, and also not surprising. But I think culturally, when it comes to firefighting, I think most people kind of culturally just kind of share that perspective that, firefighters are doing a lot of drinking. And I think that is accurate. But as far as alcoholism or addiction, I don't think that it's any more prevalent amongst firefighters than any other segment of society. There might be a little bit of an increase, so if it's 10% for everyone, it's maybe 12, 13% for firefighters. Now, the difference, though, is just the sheer number of people who are drinking. Right. And so that's where it becomes like, so for a person who has alcoholism, they're surrounded by a very normal culture where everyone else is drinking too. And so it becomes even that much more difficult to recognize or be willing to accept the possibility that maybe I have a problem, because everyone's doing it. Everybody is drinking this way. But the key thing is that not everybody has alcoholism. Even people who drink heavily, drink often. Alcoholism is a very particular kind of tier of person, and so if you have it, it's alcoholics tend to surround themselves with people who are doing it, similarly, so that they can shield themselves from having to look at themselves and say, maybe I have a problem.
A good point. Yeah, and I think you're right. I mean, in businesses, there's those Friday nights out, or, during the week, people are partying or whatever. So I think it's, it can come up in other, industries. I was a teacher earlier, and so that was probably an industry that it did not come up too much in. But firefighters I could see, or policemen, or just business people in general. So yeah, and our society pushes it so much. I mean, I think just even that comment that drinking isn't acceptable, it's encouraged. That could be for our whole society. I mean, you know, you
Mm.
see, I think that's what people feel. It's so hard when people come back from recovery. I would think that, you know, you feel like you see the ads, you go into the markets, it's just everywhere. So it's a hard thing to overcome. So can you talk a little bit about intervention? What would be a typical interventions, and what are some of the techniques that you have found helpful? And also, like, at what stage you feel like, and I'm thinking of parenting, because I work with parents mostly. So if you were working with a family, and then the parents were concerned about a child, what stage, you know, would you say come in and, you know, let's do an intervention?
Well, you know, it's interesting that you're using the word stage, because one thing that I'm quoted as saying is if you were dealing with cancer, would you want to deal with it at stage 4 or stage 1? And it's the same concept with addiction. The problem with addiction is that it's not always easily identifiable, as we were just kind of mentioning, or it's, you know, more easily deniable might be the more appropriate way to look at that. That it's scary for a parent to consider the possibility that my son might have an addiction, or my daughter might be an alcoholic, or that she's addicted to some kind of, you know, medication that was prescribed, for instance, you know, like, and to kind of go down that pathway, it can be very scary. However, it's necessary. It's really necessary to just have addiction on the same list of possible considerations whenever you start to identify something is wrong. You know, oftentimes in working with parents and, you know, clients in general, it's as though there's a willingness to admit that this is anxiety, it's depression, it's social anxiety, it's bipolar disorder, it's anything else, but it's not addiction. And addiction needs to be on that list too. It needs to be a consideration, because if it's not, that's what really allows addiction to go, you know, continue to just progressively get worse. And as a parent, if you can kind of get over the fear of the possibility that this is an addiction and you can identify it, you could start to see red flags earlier in the process, then you can start to address it at stage 1 addiction, you know, rather than waiting for it to get so bad that, you know, oftentimes family members just become unreachable. You know, the communication gets very, very difficult the longer the addiction is allowed to progress.
No, that's a really good point. And yeah, I think being proactive early on, you know, there's all those negative consequences that happen down the road. And that's interesting that you know, the comment you made about that people want to come up with any other excuse, you know, not any other, you know, anxiety, depression, explanation about what it is, but addiction. And I think so much of that, and I'm sure it's a stigma, the shame, and then also looking in the mirror. I mean, maybe they have other addiction problems in the family and they don't want to really admit that. So yeah, it's complicated. There's so much going on with it. It's a tough one for sure. Yeah. So great.
I mean, what I can say in my personal experience is that my mother, because of her background and being someone who was in recovery from addiction herself, when she started to spot that in myself, right, it wasn't something that she was shying away from. You know, it wasn't something that she was afraid to admit was possible. And obviously the advantage for her is that she knew that there was an answer for that. There was a recovery plan. There were going to be options. And I think that most families, and this is, you know, part of the reason why I started Why Intervention, is that most families are simply uninformed, not aware, terrified of the possibility that if my child has an addiction, well, there's nothing I can do. There's nothing you can do for that. There's no help, you know, and because of the common misconceptions of they have to want it, or they have to be ready, or they have to hit bottom, and there's nothing that anybody can do to possibly help an addict, and nothing can be further from the truth. I mean, that's what the intervention process is all about.
That's a great point. I think too, for example, in my situation, I think we had talked before, in your situation, you had come from a family that had gone through this. And in my situation, I really had not. So yeah, I mean, I had no idea, you know, at the beginning, you know, what to do. And I think those messages that parents get are just not so helpful, that family members get, that there's nothing you can do. They have to want it all, which is exactly what you said. And it's, Yeah, it just makes the problem grow and become worse. And it's not, I don't feel it's the right message. So, okay, that's good information. So what thoughts do you have, and maybe you've touched on this before, but what would you say to a parent? You're finding out your child is using substances, or those teen years when you find out they're experimenting, but then, maybe down the road, they're in their 20s. And, I think for parents of teens, a lot of times they think they're going to grow out of it. And a lot of kids do, or they just decide to not go down that road. But then there's the other group that gets into their 20s and 30s and whatever, and it's a huge problem. So what advice do you have for parents who are just learning about this? What can they do? I mean, I know intervention is obviously a tool, but are there any other things that you can suggest that are helpful for parents?
Yeah, I mean, the obvious one to me is to just is to be open to the possibility that addiction is potentially here, right? That there seems to be this kind of like, not my kid, right? Like, no way, it can't, no way. Like, she's a good girl, like, no way. And it's just like, it just gets breezed right past, like it's an impossibility. When the truth is that, addiction isn't something that you work your way into, so to speak. And this is after 20 years of experience of being around addiction recovery, my own experience working with hundreds of people. I mean, really, we are addicts almost from the very start. We get addicted when it's still fun. It's not like we drink and drug our way to this place called addiction. It happens almost instantaneously. And then what happens is that, much like the firefighter experience, it's like in college forever, we're surrounded by where it's welcomed and it's accepted. And so everybody looks that way. Everybody looks like they're drunk and getting high and partying. And it's just kind of this normal experience. But it's like the alcoholics and the addicts are among them. And that's what you're describing, that then when they get into their early 20s, mid 20s, late 20s, early 30s, at some point, 85 to 90% of those kids that were in college or what have you, that were partying and might have been crazy. I mean, if you looked at it, you just go, oh my God, this is, wild. But then they just start to just like kind of grow up and start families and start jobs and have, various successes, and they just grow out of that lifestyle. That is the normal kind of experience that happens for most. If you can be open to the possibility that, but wait a minute, like, let's see if there's something where, and this would take just coaching and kind of getting educated around to start see like, well, what is abnormal within all of that kind of normalcy? What are the things that start to kind of pop up that, yeah, if you speak with somebody that's knowledgeable, you say like, no, that's not really normal. Like, well, they're not supposed to get arrested for drunk driving, and what happens is that there's this kind of gradual minimization of things that shouldn't be minimized, and then as time goes on, it's like you're able to minimize more and more. You're able to minimize greater and greater consequences that should be setting off alarm bells. But because you don't know what you're looking at, or you're not even considering the possibility that this is some kind of problem, that's where all of a sudden 10 years go by, and then you go, well, I don't know what, I don't know how she got here. And it's like, well, there were signs all along if you would have known what to look for.
Good point. And I think, as you were saying that, I was just thinking about, I think sometimes parents kind of turn themselves into a pretzel trying to, accommodate, let me see if we can just make this go away. And if I pay for their rent, maybe they'll get better. And, and it was just one DUI, so maybe that won't happen again. And I mean, it can go on and on and on, because it's just really, parents feel like, I don't know how to deal with this. So that's a good point. And I think those signs are important to notice and to just be honest with yourself, and the hard thing is too, I think the people that are in this issue, have this issue, are like, would be watching this video or would be watching other ones, but it's those families, I wish more would bring into the schools and stuff. I mean, that's my big thing, because I think it's those families that are not aware of it yet, or don't have other family members who are having substance use issues that really could use the information, and they're not really getting it. So
Right.
yeah, that's
And it's a funny thing that you mentioned the schools, because I've spoken in high schools. You have people that do just wonderful work going into high schools and delivering a message about addiction and recovery and what's possible. And that's another area that I have a kind of a funny take when it comes to the idea of prevention and education. And it's like, again, anyone that's in that crowd, let's just say that you have someone that's one of the best speakers in the world, and he's going and he's speaking to a high school of freshmen, and you can guarantee that every freshman in the room has never taken a drink or a drug at that point. If you knew it for a fact, you had 100 freshmen in the room, and this person explains what happened to them, and so all of them go, "Oh, I don't want that to happen to me." That's okay, and they've been educated. So now they really understand, something about addiction from this person's experience. And then let's say the next year, all 100 of them have a drink for the first time. 10 of them are likely going to be an alcoholic. That's it. It's just like, that's just statistically a fact. And it's not going to have anything to do with that the other 90 are being more responsible because of that speaker's message that they remembered, and these 10 are being irresponsible or immoral, or they don't remember that speaker's message. They're just throwing that speaker's message out the window. They don't care. No, it's not that. It's just the action of alcohol in their body. They're addicted to it. That's what happens, and so you say, okay, so when you speak to one of those speakers, and I have, do you think that you could have prevented your alcoholism by any of those speakers? And then we're always saying, no. Yeah. So in our personal experience, we know that you're not stopping alcohol. The only thing that you really would have a shot at is somehow preventing that first drunk. And that's where it's about having an open and honest conversation with your children, because that's what studies show, is that they really do care about parents' input. They want their parents to have those kinds of conversations with them. They appreciate that. And the honest upfront talk is going to do far more than, just saying like, avoiding it or don't ever do that, and then hope that they're going to listen to that. Eventually they're going to be faced with the possibility. It's almost inevitable, right? Especially in our culture, that it's going to happen. But at least as a parent, and this is tactically maybe something useful, is you want to be on record on what your stance is, what your position is about substance use. And hopefully the position is more like, you really shouldn't use substances in your teenage years, because all of the studies show that if you are going to be an alcoholic, you have like a 90-something% chance that alcoholism started because you started in your teens. So just pushing it until you're in your 20s is going to highly reduce your risk.
Great point. Yeah, I know. I was thinking when you were talking, if we could just take these kids and put them in a capsule somewhere, and where there's no alcohol, there's no drugs, and get them till they're 21, or even ideally till they're 25, which is, their brains develop. I mean, obviously that's not reality, but yeah, it's a tough one. And I agree with you. I think it is, because I think about the kids that experimented the same as, my kids my children did, and they were all fine, but then, mine went down this road, or other, I'm sure other people the same experience. They've had friends of their children who were doing the same exact thing. But then, as you said, as they grow older, they just, it's not something that they're driven to do. It's like, it's available, they use it, but they're not the people that are thinking about it morning, noon, and night. I mean, it's just, they can get, and they can let it go if they need to. It's not a big deal, but that's, then there's that small percentage that can't, and unfortunately it feels like it's getting, larger and larger, but hopefully not. So can you talk me a little bit through an intervention? So how do you work yours, Christopher? Do you start with the families? Does it go through the fire department? What happens? I'm just curious how yours work.
Yeah, so that would be two different kind of discussions. So like what I did with the firefighting wasn't a traditional kind of sense of intervention. It's more of doing a one-on-one counseling session, and then trying to break through somebody who is potentially in denial, right? And just get them to, commit to some level of care, whether that was a inpatient treatment program or outpatient, do group therapy, continue doing one-on-one counseling, something like that. What I do privately is, that starts with family. I'm not speaking with the addicted person really at all. What I'm speaking to a parent, or I'm speaking to a spouse, I'm speaking to, in some cases, a child because their father or mother has alcohol or drug issue, and so they're asking for help with what can we do to convince this person to get help. And so the intervention process is, if I could really simplify it, it's just getting some coaching on how to have an effective conversation. And by effective, I mean, we have an outcome that we're after. We've identified that this is addiction. And in order for this person to stop their substance use, they're going to need help, and they're not going to seek that help on their own. And the experience of any family member knows that full well, right? If you've been beating your head up against the wall, they're not seeing it, they don't understand it, they deny it, they don't want help, they say they got this, or they got it under control, they can stop whenever they want to. All of those sorts of things, family members are well versed in. It's okay. We recognize that if we don't help him stop, he's not going to stop. And that's the very nature of addiction, right? And that's, kind of the intervention advocacy of, why intervention is to raise awareness on that key fundamental signature issue of addiction, is that the person with it doesn't believe they have it. So that's why they say, I don't need help, or I got this, or I don't have a problem, because they believe it. And so the recognition that something really needs to be done here. But again, it just comes down to an effective conversation, which is going to get them the help that they need, even though they don't want it, right? Because on the other side of getting the help, whether it's days or weeks or months, that's when it clicks in. And hopefully anyway, right? If the help is appropriate for them and the resources are right. But eventually what you're hoping for is the epiphany is going to be, oh, I needed help all along. Yeah. Right. And so it's not waiting for this person to hit bottom. It's not waiting for them to be ready or waiting for them to want it, because all of that is irrelevant when we're talking about a person in active addiction. They need help getting stopped. The initial stopping is the challenge with addiction. By definition, addiction means continuing to use despite negative consequences. So many negative consequences have happened to your loved one over and over and over again, and they haven't stopped. So it's not like the next one's going to be the magic one. It's getting less and less likely that they stop, because the addiction is getting more and more progressively worse. And so, again, I'm just trying to get to this simple point, but geez, look what I did for the last 2 minutes. I just kept going.
That's great.
That's great. So the intervention is really just an effective conversation, and you're going to make a determination as to how many people need to have it at once. That's really it. So if the person is really, really, really deeply entrenched in their addiction, and it's severe, and perhaps they've never stopped before, they've never gotten any help, and it's been going on for, let's say it's a drinking problem that's been going on for over 20 years. Well, then that's the sort of thing where it's like we might have to bring in mom, dad, the siblings, whoever else, but anybody that's going to have some power, influence, leverage over this person that they care about. They care about their opinion. These are people that care about them. They're coming in with the right spirit, with the intention to be helpful. It's a loving and caring conversation. It's a wonderful thing when it comes together and it's done well. But what I want to leave parents with, especially, is that it doesn't have to be that. If you can become aware far earlier, what I just described is what's required for stage 4 addiction. But my mother got me to go to my first meeting when I was 17 years old. She did that all by herself. It's not like what my mom did was like, something special. I know that you did the same thing, Kathy, for your daughter. Right. That was a one-on-one, well-timed communication that was effective, right? And so when you're armed with that, when you're armed with the facts and you're armed with that skill set, you're just, you're just ready when waiting for the moment that's going to be, oh, this is when you say that, and then and by the right thing, I just mean, what's the thing that's going to break through my denial in that moment?
Right.
And it's not intuitive. It's something that you do need some coaching around. But once you get the coaching, it's like, holy cow, it's so simple that if more people knew it, we'd be doing far better as a society dealing with addiction than, of course, we are. I mean, things are going in the wrong direction over these last couple of years. And I believe that the answer is to start with family.
Yeah, good point. I do. And I think your point too, that families have a great influence, and that, I've heard so many people say, I'm in recovery because of my family and that what they've done. And you're making a great point. I mean, intervention is super important, but families can step in ahead of time and have these conversations and be tuned in with their kids and not be in denial that this is happening or whatever. And I think I read a statistic recently, it's less than 5% of the people that are using substances want to admit that they're using them. I mean, that they're in denial about it. I'm like, oh my gosh. So, so those conversations can certainly wake people up, there's no question, and help them realize that they need to get help. So that's great. I mean, it's great work that you're doing. So thank you so much. Any final thoughts for family members? And then also, where can people reach out to you? Is there anything you want to share as far as where people, I know you have your podcast too. That's great.
Thank you. Yes. The Why Intervention podcast.
Yep.
And people can find me at whyintervention.com. And I have some, resources and free tools there that anybody can, download and make use of. The Why Intervention podcast is over 60 episodes of very helpful information, according to the people that have told me. This has been game-changing stuff. It's definitely contributes to the mindset shift that I'm hoping to accomplish, and just getting families more into the idea of there are things that you can do to help. There are things that you can do to help, and unfortunately, the experience of most people is that everything they've tried hasn't worked.
Right.
So when they hear other people tell them, then, well, there's nothing you can do to help. It's like their own experience confirms it. And then it becomes a learned helplessness. It becomes a belief that there's nothing that they can do. And then an apathy sets in. And that's where it gets really sad to witness, when, families just feel stuck and like there is nothing that they can do. But it really is just kind of like it's a mindset that you've gotten stuck into, because addiction is really, really baffling and tough to deal with. But if you get some outside help, not for them, but for you as the family member, you can begin to shift the dynamics in your relationship with them. And when you shift those dynamics, inevitably, they're going to have to change what they're doing too. It's not going to be the same game. And really, I just want to try and convey that is a simple thing to begin to change. Oftentimes I've had conversations, and I know it's likely true for you, Kathy, that you have a conversation with someone one time, one conversation, maybe for a half hour, 45 minutes, and you say a couple of things, and then the next thing you're getting a phone call from them and saying, my husband's going to treatment.
Right.
Because all of a sudden it's like they just saw things from a different perspective. They changed something that they've done every single time in response to something that happens, with their husband or with their child. And then all of a sudden it's like, yeah, you're right. I think I need to do something about this. And it's like, oh my goodness, like some kind of miracle, but it's available to everybody, but you just have to be willing to, do the investigating yourself. And the more educated you can get about this, the better.
No, that's great. And I think, yeah, unfortunately, and I think the tide's turning. I think there's that message for a long time that parents were getting, or family members, there's nothing you can do, let them hit rock bottom, all of that. And I think your message and the other people are bringing these messages in that there are things families can do. And you're right. I mean, you learn a few simple skills, you learn a few conversation tricks, and it can make all the difference in the world. And like, for example, if I'm a parent, you're the parent. And if I work with parents. So from a parent's point of view, I mean, you're the one that it's important to step back. And like you said, get those tools first, help yourself first, find out what you can about it, and then go from there. So yeah, great point. Good. Okay. Well, I will be putting all this below in the video, and then on a blog, my blog, you can check out my blog. I'll put a notes from this today. So some people like to read, some people like to watch, it depends upon what they like, how they want to do it. So thank you so much for coming, Christopher. I really appreciate it. I appreciate you stopping by, and I appreciate all the work you're doing. And it's great. And your podcast is wonderful, and you're very well spoken. I really think you are a great asset to families with this.
Yeah.
So.
And I direct everybody, if they haven't seen the podcast episode that you did with me on the Why Intervention podcast, definitely check that out.
Yeah, for sure. Okay. Thank you.
Thanks.